House Bill 96 SL 2021-110. House Bill 96 SL 2021-110 is a law that allows injectable drugs to be sold to pharmacists. The North Carolina General Assembly is dedicated to improving access to health care and better health for its citizens. Therefore, the North Carolina General Assembly is now enacting this law, considering various factors. Primarily significant to the law's passage in North Carolina is citizens benefit from healthcare providers practicing under their license. Whereas pharmacists are the primary healthcare providers, and the COVID-19 pandemic has increased the demand for services from all healthcare professionals, there was a need to adopt House Bill 96. A pharmacist may inform and educate patients and healthcare providers about the use, therapeutic value, content, and serious issues with drugs and devices. It also allows for collecting and recording patient histories related to drug therapy and device therapy. In addition, they must also conduct drug use reviews and be involved in the selection of drugs and drug sources, and the selection of device sources, as specified in GS 9085.27 to GS 9085.31. The immunization pharmacist is authorized to administer injectables following the provisions of GS 9085.15b and by regulations adopted by the Board of Pharmacy, the Board of Nursing, and the North Carolina Medical Board. These rules should be developed to ensure the safety and health of patients who receive such injectables. A bill is considered registered when passed through both houses, House and Senate. Only a member of the General Assembly can propose a bill, that is, submit it to the General Assembly, and this member is called the proposer or sponsor. As soon as the bill enters the room, additional discussions are held, and the members of the House as a whole vote to approve any amendments. The bill is then passed or rejected by a vote of members and is sent to the governor, who can sign or veto the bill. Once a bill is passed and becomes law, it is published. House Bill 96 was signed by the government and published on August 20, 2021, in a volume titled Session Laws of North Carolina. The bill now does not consider minors' opinions regarding vaccination, which is very relevant given the situation with the COVID-19 pandemic. A situation may arise when the parents of a teenager want or do not want to vaccinate their child, and this is contrary to his or her desire. On the other hand, House Bill 96 does not prevent people under 18 from getting the vaccine without parental permission. However, this is only possible through an appeal to the health department, which can significantly complicate the vaccination procedure. In addition, pharmacists cannot dispense drugs without a standing order, which is signed instructions from a provider authorized by state law to prescribe drugs. Pharmacists still need to advise patients and ultimately notify their healthcare providers. Thus, pharmacy staff cannot dispense any of the drugs described in House Bill 96 without a prescription. The state health director needs to issue an order and appropriate protocols to ensure full access to the medicines needed by the public. Pharmacies and government medical boards should also adopt standards for communication between pharmacists and primary healthcare providers.